Hi, my name is Sindhu. I'm one of the eye doctors in training in Leeds. I'm currently specializing in a condition called glaucoma. So what is glaucoma? Glaucoma is where the optic nerve at the back of your eye gets damaged over time. So the optic nerve is the cable that connects your eye to your brain, and it's what sends the messages across to your brain of what you're seeing, so you then understand what's around you. That nerve is made up, if you can imagine, it's like an electric cable, and it's made up of hundreds and hundreds of fibers. Over time, everyone loses some fibers, and that's normal. This is the trajectory with which they lose it. But people with glaucoma lose those fibers much quicker. And the only thing you can do to reduce them losing those fibers is reduce the pressure inside the eye. And the ways you can do this are by taking eye drops, laser procedures, or even surgery if needed. So when you have glaucoma, why does it matter that you're losing these fibers in your eye? Essentially what happens is you're losing your peripheral vision very slowly, and you can't tell that you're losing your vision. So one day when you're trying to cross the street and you don't turn your head to look around because you normally would see a bus, suddenly you can't see that bus, and that puts you in danger. But then you also recognize, okay, I've lost some vision now. Once you lose the vision, you can't get the vision back. And that's why it's extremely important to get diagnosed at an early stage to prevent the glaucoma from getting worse. Once you have a diagnosis of glaucoma, what we can do is try and stabilize your sight. And preserving vision is equally important than, for instance, trying to make anything better. Things to note: there's certain minority ethnic populations that are more at risk of developing glaucoma. For instance, if you're Black, you're 5 times more likely to develop glaucoma. And you're 6 times more likely to need to get registered as being sight impaired and go blind. If you have a sibling, you have a tenfold increase of developing glaucoma. So if anyone in your family has glaucoma, think, okay, I need to get my health check done, and I need to also look after my vision. Is there anyone else in my family I can take with me? And get regular checkups, and I'll come to that shortly. So, what can you do? The 3 main things to be aware of, and take-home messages that I want you to think about after you watch this video is, no matter what your age, when you turn 18, visit your opticians regularly. Any high-street optometrist can do a general checkup of your eye. This can be testing your pressure, checking your visual field, seeing if you have glaucoma, but they can also pick out other conditions that you may have that other people don't, that you may not even realize. One such condition is, especially if you have diabetes, diabetic retinopathy. There are other conditions that affect minority ethnic groups compared to their white counterparts as well, and these include things like sickle cell retinal problems, which is why going for a general checkup can pick up other things apart from just glaucoma. By visiting your optometrist, if they have any suspicion, they'll always refer you to see a healthcare professional in a hospital setting or in the community. And if they diagnose glaucoma, you will be in our system for life and will regularly monitor you. Once you get monitored, then we'll decide, do you need intervention or not? And we can always provide you with further information about what this means and how it'll affect you. The second most important thing is get involved in research. We don't fully understand why genetics affect people from minority ethnic populations more with glaucoma compared to, for instance, their white counterparts. But when you engage with research, we can find out, is the treatment we're giving you the right treatment for the group of patients you're in? Because right now, if we give generic treatment for studies that are only conducted in patients who are white, that's unfair for patients, for instance, who are Black and may need different drops, a different frequency of drops, surgery at an earlier age, and especially at a time where we're using artificial intelligence, and we may be using computer systems to diagnose and monitor glaucoma. If we don't have your data to understand how the disease affects your eyes compared to other eyes, then you may be at a disadvantage in the future. Future generations will be at a disadvantage because then we're not picking you up early enough. The third point that I'd like to stress is sometimes going to hospital can be scary, and it's easier to not attend appointments and have to hear about it than going and facing the truth of needing to take the drops, understanding the relevance of taking the drops. Maybe you may need surgery. However, being informed is a thing that's within your control. You can make informed decisions and be in control of your condition as a result. There are perceived barriers to accessing healthcare, and a lot of these are true. There are biases that exist in healthcare settings, and there's a lot of work that NHS England is putting into trying to reduce these barriers. We know this exists following COVID-19 and the pandemic, if you're from a minority ethnic background, you're probably going to have worse outcomes compared to your white counterparts, but we can stop that with glaucoma. If you get diagnosed early, attend your appointments, engage with your follow-ups and your treatment, you can reduce the impact that this condition can have in your life. You can take control over your own life and your condition. So 3 take-home messages: visit the optometrist regularly, no matter how old you are. Engage in research, find out how you can help your own community and population around you. And third, we are here to help you. There is so much support available in the community, especially in healthcare settings. We have eye clinic liaison officers. They can offer emotional support, but also practical support in the community through local authorities or even support groups around you.